Good afternoon, ladies and gentlemen. Thank you for being so prompt here today. That's very much appreciated. And we have business that we need to do today. The first hour, I would like to welcome the Minister of Health, the Honourable Leona Aglukkaq. It's so nice to have you here, Minister, to be able to present and to be able to answer questions. The committee is quite looking forward to listening to you today. So welcome. Following the Minister's hour presentation, between her presentation and the questions, we will then have the department officials stay, and we will be, you'll have the availability to answer them answer or ask all the questions that you want at that time. Committee, please be aware that at 5:15 we're going to sit in camera just to discuss some future business. There was a request to do that so we could be organized for the next meeting. So having said that, I would like to ask our Minister to make a 10-minute presentation, and then we will open up for questions. Thank you.
Thank you. Thank you very much. And members of the committee, bonjour, ublukut. Good afternoon. I'm here today with Morris Rosenberg, to my right, Deputy Minister for Health Canada, and Chief Financial Officer Alfred Sang, to the right as well. And from the Public Health Agency of Canada, Chief Public Health Officer Dr. David Butler-Jones, and the Chief Finance Officer James Libby. Please let me begin by congratulating Madam Chair on your re-election as Chair. Being elected Chair means being honored by your colleagues, and I was very honored to meet with some of you this afternoon as well. And in my opinion, among this group of dedicated members, that's a high honor indeed to be selected by your peers. While I've been meeting one-on-one with opposition health critics, today marks my first time at this table. Let me say what a pleasure it is to be together with you around this table instead of being seated across and divided by an aisle. It's times like today Canadians need cooperation among their elected representatives rather than division more than ever. And let me tell you, as Health Minister, it is my intention to be open to listen, to build effective relationships with stakeholders and colleagues as well as with my critics. While I may be new in this role as at the federal level, I come to this table as an experienced health minister from my time in the government of Nunavut. As minister responsible for the North, I bring to this table and this House a very unique perspective. I believe the national strategies need to be truly national in scope. Our vision needs to extend north of 60 if we want to be truly national. In my time as Nunavut's health minister, I was proud to work towards establishing community-based health programs, advancing a territorial public health strategy, developing a long-term health human resource strategy, and expanding culturally relevant training programs for traditional midwifery, social workers, and nursing, to just list a few. Having worked on these issues, I know that working for a healthier population means a combined effort between government at all levels, with First Nations and Inuit, with the medical and research communities. Of course, I'm proud to be here before you today, just weeks after our government made important investments in Budget 2009. As Health Minister, I'm enthused about new investments in healthcare across Canada. For example, an additional $1.4 billion is being invested in the Canada Health Transfer for a total of $24 billion. This meets our commitment to increasing the transfer by 6% annually until 2013-14. In addition, $440 million was announced to improve health care delivery and infrastructure for First Nations and Inuit. And $500 million was announced to make greater progress towards a future where health care for all will become safer, more effective, and affordable thanks to greater use of electronic health and medical records. In both of these cases, I know that investment serves only part of what's needed, and that partnerships with stakeholders are ultimately what will drive us to the healthcare success we wish to achieve. But of course, as a former and current health minister, I know full well that health means more than healthcare. For too long, the focus has been on treating illness and constantly increasing healthcare spending, rather than focusing so much on treating the sick. We need to focus more on keeping people well. Without question, treatment can, must, and will always be there for people who are sick. But imagine our country if people worked more to keep well. That means people maintaining their personal health by living healthier lifestyles, health professionals being better educated on how to help people do that. While we can't make choices for Canadians, it is our role as government to inform the choices and encourage conditions that lead to healthy choices. That's why our government has renewed Canada's Food Guide to Healthy Eating. That's why we published the Physical Activity Guide for Canadians, fund the Child Fitness Tax Credit, and work with partners to eliminate barriers to healthy choices. And it's why we remain dedicated to restricting tobacco marketing and other inducements aimed at youth to continue driving down smoking rates even lower than where they sit today. As health minister and as a parent, I sincerely commit to working with you and other governments, First Nations and Inuit, and all stakeholders so that the next generation of Canadians grow to be healthier than their parents and not less. For Canadians who want to live healthier, For Canadians who want to live healthier, let it be clear that our government is here to help. And for Canadians who have concerns about their safety of products on store shelves, in their medicine cabinets, or in their kitchen, our government is here to protect. We remain committed to an approach where we make legislative changes based on active prevention, targeted oversight, and rapid response. For example, on January the 29th, I tabled Bill C6, that the proposed Canada Consumer Product Safety Act. With this legislation, we're proposing change to an existing law that is outdated and out of step with modern times. We want to provide for better oversight of consumer products in Canada, including toys and cribs. We want to be able to act sooner and order recalls when necessary to protect Canadians from potentially harmful products that could cause injuries. We want to encourage compliance with higher fines and penalties for violators. For example, the bill proposes increasing the maximum fine from $1 million to $5 million. And to make it work, we're committed to doubling the number of consumer products inspectors. In proposing these investment improvements, we're listening to the views of stakeholders to ensure our approach is clear, balanced, effective, and fair. In addition to taking action for safer products, our government is also committed to ensuring the safety of our food supply. That's why, alongside the Canadian Food Inspection Agency, the health portfolio stands ready to support the independent investigator into last summer's listeriosis outbreak. We are eager to receive her report, to increasing our knowledge and putting into action as needed for the benefits of Canadians. Making good on our commitments to translating knowledge into action is also exemplified by the progress we're making through the Chemical Management Plan. So far, our researchers have examined 70 chemical substances which were in use long before the dawn of our modern regulations. Industries have challenged to show that the chemicals they use do not pose health concerns and are being managed appropriately. And as a result of our reviews, Several new actions have been proposed to better protect the health of our families and our environment. I want to take the time right now to thank my predecessor, the Honorable Tony Clement, for his leadership that he brought to this plan. This, of course, included moving forward to ban a sale of importing and advertising of the polycarbonate baby bottle containing bisphenol A. Through this regulatory decision, our government put families first. It represented a world first, and it clearly showed how the chemical management plan has made Canada a world leader in the safe management of chemical substances. Through our action, we're protecting the health of Canadians. And this is the same goal we're seeking from the Drug Safety and Effectiveness Network, funded by $32 million, as I announced in January. Thanks to this network, Canadian researchers will be supported in working together to examine safety and effectiveness of drugs being used by Canadians. The network's coordinating office will be housed at the Canadian Institute of Health Research. Through CIHR, the health portfolio is making strong contributions to the government-wide commitment to science. Science helps inform policy and establishes priorities for our future. And to make sure we train the next generation of health researchers, I'm happy to note that Budget 2009 provides an additional $35 million for the CIHR for the Canada Graduate Scholarship Program. This comes in addition to new support from these estimates for leading-edge research into hepatitis C and providing childhood obesity, which I know is a subject many members of this committee have worked hard on in the recent past. Indeed, these estimates reflect our government in seeking to achieve, through the actions of the health portfolio, safer products for Canadians, stronger research for more effective policy, and stronger support for improved health care and healthier choices. Offer a healthier population today in communities across Canada, including First Nations and Inuit, and an even healthier generation tomorrow. Towards this goal, as Health Minister, along with you, I commit to strive. And thank you all for the time to speak. And now I look forward to your questions.
I want to thank you so much, Minister, for your presentation. We're now going to be going into our line of questioning, and I just want to remind you that we'll have the Liberal side for 15 minutes, the Bloc for 10 minutes, the NDP for 10 minutes, and the Conservative for 10 minutes, and then we'll go along that recycle following that. And the second round, as you know, just to remind you, is 5 minutes. So I'm just talking about the first round. And Dr. Bennett, you have 15 minutes, and I understand you're sharing your time?
Yes.
Thank you.
Thank you very much, and thank you very much, Minister. And your amazing reputation precedes you in terms of someone who truly understands the difference between health and health care. And so I guess my line of questioning will be around the problem that you've inherited in a government that has, by choosing health as part of the strategic review, has now a reputation that has put many, many, many community organizations and programs at huge risk. That the idea that all of the grants and contributions are now sitting somewhere where the Prime Minister's office can look at them, and particularly we are concerned that the ideology and other interests are not exactly, or perhaps strategic review is just code for the Prime Minister's office getting to pick and choose. It has meant that community organizations and programs have never been more insecure. In fact, the reputation in your department, Minister, is that things that have been promised year after year after year go through the proper channels, go all the way up through the department, and then would be killed on the desk of the previous minister. This has created huge insecurity, and it means there are tons of programs out there that right now do not know whether they're getting their money March 31st. And so I'd like to just go through a little checklist, where maybe you would be able to say yes or no. Will these people be able to expect their money or not? Because what it seems to me is everything in your estimates that has the word grant or contribution has big brackets with millions of dollars now missing because of the strategic review, as it is there on page 138, grants, with a big bracket 4,873,071. So I think that you must be upset that the healthy eating program's gone. The Aboriginal Wellness Program is gone. The Centres of Excellence for Women's Health seem to be on some lifeline for having maybe extracted 1 year. The Centres of Excellence of Children's Wellbeing still don't know. The Health Council of Canada still does not have any funding after March 31st. HIV/AIDS groups across this country don't know if they're getting their money or not. You've got a terrible report on the National Pharmaceutical Strategy. What are you going to do to have the people who actually do the work in the communities feel secure that you, as the new minister, understand the importance of these things like women's health, children's health, and particularly research? It is astounding that in terms of increasing efficiency and effectiveness, that granting councils can end up with less money when their only job is to get money out the door. So I just would like you to tell us, and how are you going to make the community organizations feel more comfortable about what their life after March 31st, 2009 or March 31st, 2010?
Thank you. Thank you, Dr. Bennett, for your question. I sense your frustrations, and I look forward to working with you to address some of your concerns and some of your questions. While I'm here, I mean, we're discussing, we're not here to really discuss the budget 2009 or get into the specific of the strategic review. What I will say is that under the Health Canada, the Public Health Agency, Canadian Institute of Health Research have undertaken the review to better align programs to science, research, and support Canadian health. And I'm a strong believer in that we need to do some reviews in the delivery of how we manage programs. As an example, the legislation I introduced in the House is 40 years old. And that went through a review, and it was necessary to introduce a legislation that is keeping up with time, and it's just good business to periodically do reviews of our programs on a regular basis, and as we try and serve Canadians. But basically, as a result of these reviews, the government is refocusing its programs to better deliver on its core federal role in health, realigning existing resources and programs to improve management of risks to human health, and so on. I would be very happy to return to this committee to discuss with the honourable member in the spring the more in detail. As it is right now, we're focusing on the implementation of some of these changes that we're proposing. But I can also say that some of these programs in HIV/AIDS, Health Council, there is ongoing funding to support those important initiatives as outlined by my colleagues. So I'll leave it at that. Thank you.
I look forward to that, and I think that maybe if you look at the transcript, you could give us maybe table or send to us yes or no answers on the Centres of Excellence on Children's Wellbeing, the Health Council of Canada, which is actually a new program, probably the most important recommendation of the Romano Commission, and exactly how the HIV/AIDS funding would be broken down. I guess one of the other things that bugs me is that we are going to be asked as a committee to look at the statutory review of the Assisted Human Reproduction Act, and yet we've never received the regs for this other than for Chapter 8. So I guess I want to know what on earth the agency can be doing when it doesn't even have any regs, and it's now time for us to review the Act. And it looks like you've transferred $75,000 to CIHR out of the budget of the agency. And I guess I would like to know how can this agency even be acting when, or doing anything if we still don't have the regs?
Madam Minister.
I'm going to refer to Morris.
Thank you, Madam Chair. Just on the latter part of Madam Bennett's question on the transfer from the agency to CIHR, the purpose of the transfer of $75,000 to CIHR from Assisted Human Reproduction Canada is to support specific research in the areas of assisted human reproduction and reproductive technologies. The goal of the program is to facilitate the dissemination and uptake of research results through appropriate knowledge translation strategies and activities based on the best evidence resulting from the completion of grant research. The specific research will be focused in the area of assisted human reproduction and reproduction technologies. I can give you more detail on that if you want to have it. This would include things like artificial insemination, ovarian stimulation, gamete intrafallopian transfer, zygote intrafallopian transfer.
Yeah, but I guess the issue is this is an agency that's supposed to be regulating and having couples who are having difficulty forming families feel more comfortable that this is an area that now is regulated. We decided we need a law for it. We don't have a law and we don't have the regs, and now we're being asked to review the law. So I hope that the minister will get us the regulations before we have to review the law. Go ahead.
Let that go.
Yeah. Thank you.
Madam Minister, did you want to comment on that, or do you want Ms. Murray to ask her question as a further?
I can comment on the
Thank
government
you.
has brought an appeal before the Supreme Court of Canada to address any questions regarding the constitutionality of the Act, and out of respect for the authority of the Supreme Court of Canada, Health Canada will not pre-publish the regulations, for what I understand, until the question before the court has been resolved. Thank you, Madam
Mr.
Chair.
Rosenberg, did you want to make a comment on that as well?
I can elaborate on that a little bit just by way of context. As the committee may be aware, the government of Quebec brought a constitutional challenge by way of a reference to the Court of Appeal of Quebec some time ago. The Court of Appeal of Quebec issued its decision in 2008 and found that parts of the Assisted Human Reproduction Act are unconstitutional. We have challenged that. We have appealed the ruling of the Court of Appeal of Quebec. We think that it's important, given that there is uncertainty in this area, to get guidance from the Supreme Court of Canada. We will be continuing to work up our regulatory projects in the meantime. We are moving forward quickly. We have filed our factum. A number of provinces have intervened. They will be filing theirs, and I believe the hearing will take place over the next few months. Just typically, Supreme Court decisions take about, no guarantees, but around 6 months. We want to be in a position very quickly to move after that.
Ms. Murray?
Thank you. Minister, I'm going to just ask a couple of questions to understand your government and your department's approach to research. There's some seemingly contradictory statements. On the one hand, we hear that that you want to work well with the research communities. On the other hand, there's some pretty major reductions to the granting councils. And we see in the strategic review there was $6.3 million that was taken out of, that was refocused research towards the advancements of science. So I'm not sure how you refocus by cutting $6 million. But it's the Genome Canada funding that I'm most interested in. I see in the supplementary estimates that you're asking for an additional $4 million for the Genomics Research and Development Initiative. And meanwhile, Genome Canada, that was expecting $120 million, was very disappointed to see no additional funding, and they believe that only research that's well underway can continue and nothing new can start. It's like we fell between the chairs, said the President. So could you tell me, is this $4 million making up for the $120 million that is being cut from future funding for Genome Canada, or what is that budget for?
Madam Minister.
Thank you, Madam Chair. Our government is making strategic investments in the health and safety of Canadians. This includes health research. For example, in the area of Genome Canada has stated they are pleased with the federal government's 2009 budget. It's an industry lead. So the question specifically to the $4 million, I will ask my deputy to explain that allocation in more detail. Thank you.
Thank you. Just to be clear, the Federal Genomics Initiative is, I think, what the question refers to, and that is not Genome Canada, which is a responsibility, which is under the industry portfolio. So the Federal Genomics Initiative is a horizontal research initiative that includes Health Canada and the public health agencies, as well as several other departments, including the NRC, Fisheries and Oceans, Natural Resources, Environment Canada. The initiative supports research and development performed in federal government labs, and that should be distinguished from Genome Canada, which supports large-scale initiatives performed in universities and in industry. That being said, we do at Health Canada collaborate with Genome Canada scientists to new projects to understand the molecular basis of nutrition, radiation impact, environmental toxicology, markers for carcinogens, and hepatitis C treatment will be undertaken under this genomics research and development initiative. So that is what that $4 million is about.
So we may expect to see Genome Canada having its funding continue, and I certainly I know a lot of researchers out at UBC that feel that that's an important investment that will otherwise see very talented people moving to the United States. I do have a second issue I wanted to raise, and that's harm reduction. Again, there's a nod to science and research and scientists, and as we know, the far majority of peer-reviewed research supports that harm reduction. The Insight site in Vancouver saves lives, but I didn't see anything in the supplementary estimates to fund, to support, to in any way continue with that harm reduction program. And so, Minister, do you have the same view as your predecessor, that the Insight and that harm reduction is an abomination, or is this something you support and we might see you taking a different approach?
Madam Minister.
Thank you, Madam Chair. A notice of appeal was filed, as the member knows, with the BC Court of Appeals on June 30th, 2008. This appeal is set to be heard early this year, and as the matter is before the courts, my comments on that matter are limited. I mean, we have to respect the court process. I want to be clear that we agree that injection drug users are in need of assistance. And our government has invested $100 million over 5 years to improve access to treatment for drug addiction. And of this, $10 million was also set aside for the Vancouver downtown east side. The funding will create and has created 20 new transitional recovery beds to help individuals with drug addictions, and I understand that facility was opened last week. The focus of our national anti-drug strategy is on prevention and treatment for those with drug dependencies, and we care about preventing people from, especially our young people, from becoming addicted to drugs in the first place, and that's the approach we're proud of taking to Canadians. Thank you, Madam
With respect,
thank you, Madam Minister. Monsieur Mello.
I don't think
your time is up.
Time is up. Okay.
Monsieur Mello.
Thank you, Madam Chair. Madam Minister, welcome and congratulations on your appointment. As such, before I begin discussing the supplemental estimates, I'd like to talk about one aspect of your presentation. You said that you were hoping, through various initiatives, to reduce smoking, to bring it back to lower levels than current rates. And yet, when when we look at the public accounts of 2007-2008, we can see that the contributions to the smoking strategy were reduced by $13 million from a total budget of about $15.7 million. So $2.8 million were spent from this initiative. Can you tell us how these two statements make sense?
Madam Chair, first of all, I'd like to make it very clear that our government and the Prime Minister is 100% committed to cracking down on all tobacco products marketed to children. This was a clear commitment made by our Prime Minister in the last elections, and this is why we will be taking actions by we intend to be setting a minimum package size for cigarillos in the that it is less affordable to children, prohibiting flavors and additives that would appeal to children, and banning all tobacco advertising and promotion in print and electronic media which may be viewed and read by youth. We will not tolerate tobaccos being marketed in ways that is enticing to children. That's my general comment around tobacco. One other thing that I would also like to state that Health Canada transfers under the Canada Health Transfer Act $22.6 billion on an annual basis to deliver healthcare services and prevention programs, promotion programs, and so on, in addition to what we invest in at the federal level. And I believe that's...
Thank you, Madam Minister. Monsieur Malo?
Peut-être Monsieur Rosenberg aurait quelque...
Perhaps Mr. Rosenberg could provide further clarification on this $13 million. Unfortunately, I can't give you details today, but I will take it upon myself to find this data, and I will send it to you through the committee over the next few days. Thank you very much. Now, with respect to the supplementary estimate, we can see for the Patents Review Board, there's about twice the estimated amount that will be spent. $4.7 million have been added. Can you tell us why? Why has there been an increase? This is quite a substantial increase, and how will these amounts be spent? For what purpose?
Mr. Rosenberg?
You
I'm
should
sorry.
address the chair.
Madam Chair,
Yes.
je vais essayer.
Try to answer your question. First of all, I'll try to answer the question, but I must say at the outset that representatives from the Patented Medicines Price Review Board will be appearing before this committee on Thursday afternoon. They'll be able to provide you greater detail. But generally speaking, the work of this board, this money is to deal with disputes between pharmaceutical companies. These costs have been very high over the past few years, so the operating costs have increased as a result. But as I said, representatives will be here on Thursday, and they will be able to provide you more details. So we're going to have to keep all of our questions for Thursday and see why this money is being put in as a vote, because there are quite a few questions that we have, and a lot of people are wondering whether the mandate of this board is really being affected. Is it being broadened? Is the scope of the mandate being broadened? We'll wait until Thursday to get that answer. Well, with respect to the Assisted Reproduction Agency, Madam Minister, you said that you were waiting for the decision from the Supreme Court before proceeding, and that you didn't want to anticipate what the decision would be. Mr. Rosenberg said that despite this, funds had to be spent to go ahead with regulations which may not actually be printed. Spending money on regulations, do you feel that this is necessary?
The government is currently, I think, the deputy was quite clear in that the government is currently appealing a Quebec court decision and will not proceed further regulations until the matter has been resolved. But in the meantime, Health Canada is continuing to work to develop regulations and assisted human reproductions. Canada continues to provide information and respond to any or some concerns, and that's where that's at this point in time. I don't know if there's more to add from that question because I think the deputy had addressed it earlier on. Thank you.
Thank you, Madam Minister. Monsieur Mello?
Mr. Mello? Mr. Rosenberg? How is this money being spent? This $12 million. What is it being used for exactly?
Mr. Rosenberg, would you like to make comment on that since that question was directed to
Thank you. I just want to be clear that we're talking about the same thing. My comments earlier were about a $75,000 transfer from the Assisted Human Reproduction Agency to CIHR. What I said, ce que j'ai dit, c'était que cet argent-là.
I said that this was for research purposes, not for regulatory purposes. But the $12 million in total that are being allocated to the Assisted Human Reproduction Agency, how is this money being spent if, as the minister said, if we're still waiting for a court decision? Madam Chair, the agency does exist. It is working. There is already a group of regulations under Chapter 8 which are currently in effect. This agency provides advice. It shares information. So it is in operation, but perhaps not as completely as it will do when it gets the full spate of regulations. But we're working on this. I think that the money has been spent. I can also say, like other agencies that are part of the health portfolio, this agency will have an opportunity to appear before you, including this agency, and Madam Wilson will be able to give you greater details.
Could I just intercede here, Mr. Rosenberg, because actually that agency will be coming to committee on Thursday. So, Monsieur Mello?
Donc, vous nous dites que
So you're saying that the Assisted Human Reproduction Agency will be appearing on Thursday, Madam Chair, so we can ask them how this money has been spent. Thank you. Thank you for this clarification. Could you tell us whether the supplementary money will be allocated to accelerate the approval process by Health Canada? How will this money be reallocated? How many products need to be approved? I believe that this is a concern amongst manufacturers. Can you tell us how this new money will facilitate or accelerate the whole approval process for health products?
Thank you. Just for clarification, I'm assuming that the member is referring to the natural health products processing. Yes. Madam Chair, our government tabled amendments to the Food and Drug Act to modernize and strengthen it last year. And during the elections, we have promised to bring this legislation forward again, and we will be doing so in the near future, just to clarify that. This legislation is also about ensuring that food is safe. It's also about strengthening our abilities to protect Canadians from harmful drugs and ensuring that natural health products are widely available, safe and effective. So this legislation will be coming forward for all members to debate when the time comes. In terms of the natural health products, this government is committed to eliminating the backlog of product applications by March 2010. We have released online, we will be releasing online the progress report on the processing of those permits for natural health products. I believe it's supposed to be posted either today or yesterday or tomorrow. This week sometime it'll be posted. That will also indicate and show you how many processing has been placed. From what I also understand, there will be online applications to speed up the process. From last year, we were very backlogged, but on average, we're processing about 200 applications to respond to that backlog and processing. I can give you the details of all the information as well, or you can wait for the report to be posted on site. I think it's posted on site today. Thank you.
Thank you very much, Minister. Ms. Washley-Slees.
Thank you, Madam Chairperson, and thank you, Madam Minister. Congratulations on your election and your appointment to this very important portfolio for the Government of Canada. I want to start by talking about what you consider to be core responsibilities for the department. It would seem to me that nothing is more important and no more central to the core of your department than the preservation of our national public health care system. Yet, as you know, we're facing serious erosion of that system with user fees popping up all over the place, with private for-profit clinics multiplying before our very eyes. And I would like to know from you, Madam Minister, how you intend to, and I would imagine as a minister in the Nunavut government that you're aware of the importance of having access for all people in this country who are not denied services that they need because of money or geography. And so you probably understand the importance of a non-profit healthcare system. I'd like to know what you are doing to ensure that. So my questions on that front are threefold. Number one, have you sent notices to the provinces whose transfer payments for healthcare were cut back in this budget? Have they been assured that, in fact, that money is put back and they don't have to worry about meeting that difference this year? Number two, are you prepared to come to this committee and actually talk with us about the Canada Health Act, which must be reviewed by this committee and something we had great trouble in the past getting the minister before our committee to address. Yet it goes to the heart of everything we believe is important in terms of our Medicare system. Thirdly, would you analyze and go over this extensive report by the Canadian Health Coalition entitled Eroding Public Health Care, which documents in over several hundred pages the evidence that shows just how deeply our system is being eroded and how people are being denied access? And finally, would you just comment on whether or not your government's previous commitment to P3s is now being reassessed by your department, given the most recent knowledge showing that the Brampton Hospital will actually cost $194 million more than it had been that had been stated it would cost publicly. It will cost at least $200 million more over its 25-year lease. So those are four questions just on that issue, and then I'd like to ask something on pharmaceuticals.
Madam Minister.
Thank you, and I'd like to thank the member for her questions. And sometime I'd like to also invite the committee to Nunavut and to see some of the challenges in delivering health care. And I recognize the members' concerns, and I want to be very clear with my colleagues here that our Prime Minister and this government is 100% committed to a publicly funded universal health care system, which represents, again, the principles of the Canada Health Act, and I'm in support of that. This government also believes that there are many innovation and experiments that can occur within a publicly funded healthcare system in a manner that is consistent with the requirements, again, under the Canada Health Act. The Act requires provincial and territorial insurance plans providers to be covered coverage for medically necessary physicians and hospital service without charge at the point of service. So for the most part, provinces and territories' health care insurance plans are in compliance with the Act. In regards to the fundings to the provinces, I mean, I was at the provincial level receiving the funding under the Canada, or territorial level receiving the Canada Health transfers, and in every year that funding was increasing.
Yeah, my question
our government has committed.
Could I just on that question, would it be okay if I just seek clarification on that?
Could we please let the minister just finish, then you can just...
Okay.
I'll be done in a
Madam
second.
Minister.
Our government supports the health care and the transfer, and the 2008, 2009 to 2010, the Canada Health transfer will grow by $1.4 billion, and that to a total of 24 from 22.6. And again, this support will continue to grow by 6% annually, reaching over $30 billion by 2013-14. And my officials can provide more information on the details of the health transfer.
No, I appreciate that very much. My question was quite a bit different. My question was on the acknowledged shortfall that about half a dozen provinces were subject to in this last budget, and it's been acknowledged by your government. I just simply want to know if you have let those provinces know that the money will be restored. That was one question, yes or no. And secondly, will you agree to come to this committee and deal with the Canada Health Act annual report, which we are obligated to review and for which we expect some dialogue with the minister? Just yes or no on both questions.
Madam Minister.
Thank you. Right here. The government again, the government again transfers to provinces has grown in terms of the breakdown. Again, I'll ask my officials for.
It's just yes or no whether the provinces have received notice. That's all.
Madam Minister, did you have anything else to say? I would ask that all members will listen very carefully, and I'll make sure you get all your comments in. I would just ask to be respectful, letting the minister finish your comments, and I'll make sure you have time to ask your questions. Ms. Wachalis-Elise.
I think I'll go on. I'm not going to get an answer to that question. And we didn't get a commitment from the minister that she will come, so I will try a motion again before the committee on the Canada Health Act. Let me ask about the pharmaceutical strategy, which has now been in the works for over 5 years, the national pharmaceutical strategy that federal provincial ministers agreed to. We're no further ahead. Nothing has happened. We just received another report from the from the Health Council on a prescription unfulfilled, where they clearly make the point that at a time of economic recession, nothing is more important than people being able to access the drugs they need. Yet we have not had one whiff of commitment from this government about how they're planning to proceed. The latest provincial offer was for 50-50 cost sharing on catastrophic drugs, 50-50 cost splits to meet costs for drugs for rare diseases. I would like to know where is the federal government on those two ideas and with respect to the national pharmaceutical strategy. This is rather urgent and important.
Madam Minister.
Thank you, Madam Chair. I think it needs to be clear. I've been around the provincial tables, federal provincial tables for the last 4.5 years. There has been no agreement in terms of the national pharmaceutical strategy around that table. We've had a number of discussions around how to try and deal with the issue. I wanted to be very clear that, again, our Prime Minister is committed to upholding the Canada Health Act. And I think it also needs to be very clear that the provinces and territories deliver health care, including deciding which prescription drug would be included in their formulary. And this is a provincial territorial responsibility funded through the Canada Health Act. We are committed to working with the provinces and territories to make our healthcare system more efficient and by working together with our partners, but we can find savings that can be redirected to public drug plans, and I continue to and will continue to work with my provincial territorial colleagues on that very issue, as I recognize it is an important subject, but the last 4 years we had not made any decision on how to proceed with that matter. Thank you.
Ms. Wachalis-Elise.
Thank you, Madam Chairperson. I guess I'm tempted to ask, is there at least a national pharmaceutical strategy somewhere at work, at play in the bureaucracy? But maybe we'll come to that another day. Maybe I could suggest you look at Life Before Pharmacare, which was a report on Canada by the Canada Health Coalition after extensive hearings across this country documenting what happens to workers when they lose their jobs and they don't have access to pharmaceuticals, and why this issue is growing in importance today. Let me just ask 3 short questions. Number 1, on can the organizations dealing with services regarding HIV and AIDS be guaranteed that they will not receive any more cutbacks this year, since they had a huge cutback last year? Further to the Block's question, the $12.9 million that was not spent under tobacco strategy, where did that money go, and why was it not put at least towards dealing with the elimination of the previous minister of the tobacco strategy for First Nations and helping deal with a serious problem at that level? Thirdly, the CIHR funds that were cut in this budget, down from $932 million to $998 to $932 million. Is there any chance that that could be reconsidered? And some of the organizations that have been begging with this government for some assistance, like juvenile diabetes, would they be able to have some access to some of that money?
Just about out of time. Could we give the Minister just some time to answer some of your questions? Madam Minister.
Thank you. I look forward to meeting with my colleague later today to perhaps discuss some of these in more details without the time restriction. Around HIV/AIDS federal initiatives, the government has demonstrated very clear leadership, and in going through the material last year, we invested more than $84 million towards HIV/AIDS research initiatives, and that is the most that has ever been spent in the history of this nation around HIV/AIDS funding from this government. The investments will support the federal initiative to address the AIDS and Canadian HIV vaccine initiative. Community groups will also receive more than ever before funding to support that. And our Prime Minister has demonstrated leadership through our investments of $130 million over 5 years in partnership with the Bill and Melinda Gates Foundation. And again, I believe that the commitments towards this initiative are clear in that we are committed to this program on an ongoing basis. Thank you, Madam Chair.
Thank you, Madam Minister. We're now going to start with Dr. Carey, and I understand that there's going to be a sharing of time. There's 10 minutes, so Mr. Brown, Mr. Uppel, Ms. Davidson, and Ms. McLeod will also be asking questions, so we're going to have to be very mindful of the time. Dr. Carey.
Thank you very much, Madam Chair, and I would like to get right to the question, Madam Minister. I'd like to talk a little bit about product safety. It seems that lately we're seeing an increase in the number of recalls. We've heard about the lead paint in children's toys, crib recalls, and I've just gotten another email today from a constituent in Oshawa, where I'm from, and I think people are really concerned with globalization and about the safety of these consumer products. And I was wondering if you could elaborate on what the Government of Canada is doing to ensure that these products are safe.
Thank you for the question. Protecting and promoting the health and safety of Canadians, their families and communities is a priority of this Conservative government. Canadians should have the confidence that the products they buy are safe, and that is why we are reintroducing the Canada Consumer Product Safety Act. This is about equipping our government with the tools needed to act quickly and effectively to protect Canadians. This also includes the increasing the frequency of sampling and testing and doubling the number of inspectors. As well, this legislation was outdated. We needed to reintroduce it, to modernize it, to reflect today. I mean, it's about 40 years old. Legislation is very outdated. And I call on the opposition members to support our legislation and to help protect children and Canadian families. Thank you.
Thank you. Sorry.
Wondering, Madam Minister, if we could clarify too. I believe Madame Washali-Solis mentioned about the transfers, and I believe that the transfers are going through, where every province and every territory is going to be getting what they are expecting. Isn't that true?
Madam Minister.
Budget 2009 proposed adjustments to the Canada Health Transfer, which were further detailed in the Budget Implementation Act, and a letter from the Minister of Finance to the provinces and territories will be sent out on Friday, or was sent out on Friday, February the 6th, 2009. The adjustments are intended to ensure that the transfers take place. So that's where that's at. Thank you.
Mr. Brown.
Thank you. Madam Minister, thank you for your presentation today. Recently, I had a doctor in Barrie, Dr. Craig Curfey, call me about the natural health product approval process and how sometimes it can be difficult. And I wanted to ask Madam Minister if there's any work being done by the government to make that process for the approval of natural health products easier in Canada.
Thank you very much for your question. The issue around natural health products process has been one that our government has been trying to address the whole backlog of the process. Our government is committed to eliminating the backlog by March 2010. As it is right now, tomorrow, I believe, or this week, we're releasing a report on progress made to the natural health product application process. From what I understand, I'm just going to read the notes as to some of where we are at with that. There have been no backlogs in site licenses, establishment license. 804 establishments licensed as of February the 4th. We're on target to reduce the backlog in license applications by 2010. Over 10,000 licenses have been issued. Rate at which product licenses are issued is steadily increasing, and progress is continuing in that area. We've also made a number of business process improvements in place to reduce the backlog. We're launching a natural health product online system shortly, where license will be issued within days. Fast-track approach for review of low-risk natural health products, and that'll be online. Batching applications of similar products types to allow for faster processing. We're also simplifying and streamlining the applications and review process by working with the industry. We're delivering workshops to assist industry in improving quality of application, standardization, labeling requirements, and standardizing general claim requirements. We're providing a quarterly progress report and backlog reduction to be posted online October-December 2008 as an example, will be posted this week. Launching a database that allows consumers and users of natural health products so that they know which natural health products has been licensed by Health Canada. So the rate of licensing is greater than rate of review, so it's important information. So that is where we are at, and we're making progress in the area, and we will continue to work with industry to ensure that we're addressing their concerns. Thank you.
Thank you, Madam Minister. Mr. Uppal.
And thank you, Minister, for taking the time to be here with our committee. Approximately 7,500 research laboratories across Canada conduct research dealing with human pathogens and toxins. Currently, the laboratory biosafety guidelines are mandatory for only 3,500 labs which import human pathogens, and as such are subject to the human pathogens importation regulations regime. For the remaining 4,000 labs which use only domestically acquired pathogens, the laboratory biosafety guidelines serve as a guide but are not mandatory. Minister, what is being done to increase and to ensure laboratory safety in Canada and to standardize Canadian biosafety guidelines?
Madam Minister.
Thank you, Madam Chair. First, I'd like to say that the Human Pathogens and Toxins Act will ensure a more secure environment for handling pathogens and toxins for Canadian research. I'm introducing a bill which will strengthen safe handling practices for most dangerous pathogens and toxins. It will also balance the requirements of biosafety and biosecurity with strengthening scientific research in Canada. And I'm proud the legislation will be introduced that reflects what government has heard from our partners, and will continue working together in order to safeguard the health of Canadians. The Government of Canada is moving forward to fill the significant gaps in the safety and security of that area, as I mentioned before. Currently, only facilities that import human pathogens and toxins must follow lab biosafety guidelines, while non-importing facilities only operate under voluntary guidelines. Canada also requires improved security regarding these agents. The Human Pathogen Toxins Act will address both of these gaps to mitigate the potential risk posed by the inadvertent or deliberate release of dangerous human pathogens and toxins. Thank you.
Thank you, Madam Minister. Ms. Davidson.
Thank you very much, Madam Chair, and thank you very much for appearing before us today, Minister. I just have a quick question on health human resources. We know that in Canada that we've been experiencing shortages in the human resources area, and we know that internationally trained physicians and professionals are experiencing challenges in having qualifications recognized. And then I also noted that in your address to us earlier, in your time as Health Minister at Nunavut, that you had developed a long-term health human resources strategy. Could you elaborate a bit on that, or are there things there that you could bring to the table to help us federally as well as you did in the territory?
Thank you, and thank you for that question. The experience that we had in Nunavut in trying to address the shortage of healthcare professionals, it was it was a challenge for us to address. But like any other jurisdiction in Canada, Nunavut faces the same challenges as any other jurisdiction, and that's to address the whole issue of shortage of healthcare professionals. Recognizing that the approach that we took was to try and train within our own territory that reflected programs that were culturally relevant to the people that would be served in that territory, to try and deliver programs and services in the home, in the smaller communities, to develop some mobile programs where we were able to take the training into the community levels. And in the last 4 years, we made a lot of investments in Nunavut to train in Inuktitut, to train using traditional practices such as midwifery program, to incorporate the knowledge of traditional midwives into the healthcare system, to train in the area of nursing programs in our territory, reflective of the fact that the model of healthcare delivery that we deliver in the north. We have one hospital in 25 communities. The jurisdiction of Nunavut is huge. How we deliver healthcare is quite different in other jurisdictions where we have limited access. Technology was also introduced as part of the teaching tool. Telehealth investments in every community. And so there's different models, and I have the work, but it involved a design of a healthcare system with the involvement of the healthcare delivery people. The nurses were there at the table to design it along with us to address some of the challenges that they face in remote communities in the delivery of healthcare. They are our frontline workers. Nurse practitioners are frontline, and to try and design programs that would support keeping them in the community level was very important to us. So it was not a top-down approach, it was a bottom-up approach to a long-term 20-year strategy that involves tapping into the high school graduations, supporting the students through the school system, at the same time maintaining them once they got into the system. And so it was quite long-term, and like any other jurisdictions, we're facing the challenges, and every province and territory faces the same challenge as we are competing for a very small pool of skilled people in our country today, whether it be nurses, whether it be doctors, and so on. In my work and travels to various jurisdictions, we're struggling with this, and my view is that collectively provinces and territories need to tackle this head-on. How do we come up with a strategy at a national level that would support each other instead of having provinces and jurisdictions compete against each other with that small pool? Recognizing that the issues and concerns that have also been raised by provinces relate to credential recognition, the lack of mobility within Canada of our healthcare professions because of the processes that are in place. And they've, some have expressed an opportunity to look at that there's ways that we can make it easier for our healthcare professions to move around in our country. At the same time, to support our students, to support our nurses, to have that choice to travel to jurisdictions. So it's a huge challenge. I'm open to discussions on that, and I look forward to working with my colleagues and as well as stakeholders in how we can perhaps address that, to address the issue of the shortage in healthcare professions in our country. Thank you.
Thank you, Madam Minister. Our time is up now for this session of rounds, which was the 10 minutes. So, Madam Minister, I know that you had said that you needed to be here for an hour and then you had another commitment, and that the officials would stay for the duration until 5:15, when at that time we'll go in camera for our business. So it's just at the will of what you can do, Madam Minister. So it's been a pleasure having you here. I don't know if your time is, my understanding is you do have to get to another event.
Mm-hmm. I would like to thank my colleagues here, and I look forward to working with you. I would like to also say that, I'm open to listening to your views and your concerns, and I think it's very important that there be a continued open relationship to discuss some of these challenges that we face in our country. For that, I'd like to thank the members for their questions and their comments, and please at any time feel free to come speak to me on various issues, and I look forward to working with you. But having said that, I would also like to invite the committee members to Nunavut. I would love to host a health committee meeting at any time in Nunavut so that we learn parts of our country that's very unique, and I look forward to sharing that information with my colleagues. Koyanami.
Thank you so much, Madam Minister. Now, what we're going to do is just continue our questioning. It will be upon the minister's departure from the committee meeting. We will then start our second round, and the second round will be 5 minutes in duration. The officials will so kindly stay so you can direct your questions to the officials, and we will have the same order, which is Liberal, Bloc, NDP, and Conservative. But just remember that instead of the 15 and 10-minute time slot, you only have a 5-minute time slot. And I would like to begin with Ms. Duncan.
Thank you. I'm going to address 3 questions. They're from 3 very different areas. The first is regarding why public health funding is being used for security for the Olympics, and also what health promotion will be done with monies for the Olympics. That's the first question. The second question is, we know today that if we have healthy children, we keep them healthy, we have healthy adults. So if we can reduce obesity in children, we potentially reduce some cancers, diabetes, heart problems, etc. in our adults. So I'm wondering what monies have been directed to prevention and remediation of childhood obesity? And the last question, what monies have been directed to pandemic preparedness in Canada? World Health Organization still considers pandemic flu one of the most pressing health issues facing the planet and warns against complacency. And what money is available for addressing the limited shelf life of Tamiflu? I believe that stock might reach its shelf life this year. Thank you.
Who on the committee would like to answer? I know Dr. Butler-Jones, you have quite a bit of background. Would you like to start first on this issue?
Certainly. Thank you, Madam President. I'll start on those questions, and then I know that because it's a partnership between ourselves and Health Canada on this, and CIHR for that matter on the research and evidence side. In terms of the short answer around the public health funding in the Olympics is that we're very much involved in issues of health security and in preparation for the Olympics around both bioterrorism as well as other events, like if there was a pandemic or even seasonal flu or an outbreak during the Olympics, we will have our portable lab on site, and we'll be working very closely with the provincial health authorities around dealing with broad-scale public health events, and it's for those kinds of purposes that we're engaged. On the health promotion side, there's a number of things that are going on. Again, most of this is obviously in partnership with the provinces and territories, specifically in BC, Act Now BC, which has a whole-of-government approach to physical activity, nutrition, etc. We have agreements with the provinces around healthy living agreements. Most of now are in place and are being sort of talked about and worked on. The funding for participation, but also the work generally that we're doing around fitness, lifestyle, and even the kind of community approaches to how we deal with it. In terms of childhood obesity, that's clearly an issue. I've said it before, and it continues to be a challenge. The risk that if we're not successful in this, that this generation of children may be the first to not live as long or as healthy as their parents. And fundamentally, it's a multi-sectoral issue in terms of the roles that we play, both around working with the food industry, etc., as well as working with the provinces and territories. There are a number of mechanisms in place that, in terms of trying to address this more effectively across the jurisdictions, and it's not like there's any one part of the system that can address it effectively. It's gratifying that people are actually talking about this. I mean, we kind of lost 10 years, but people are actually starting to pay attention. Every jurisdiction now has an initiative or a focus on this, and you look at deputies where we meet, where Morris and I go meet with our PT colleagues, ministers' meetings. These kinds of public health issues are on every agenda now. 5 years ago, it was rare to even see that talked about. So, Morris?
Ms. Duncan, did you have?
I would like to hear about the pandemics. Thank you.
Oh, so I'm sorry. Yeah, there's a number of, we continue down to work on that. As you probably, the committee will remember, we do have a national plan for the health sector, as well as an international plan. We have a North American plan in place that continues to be revised. We're unique in the world still in having a vaccine contract with a domestic manufacturer to produce sufficient vaccine for the total population. And we also have in place stockpiles of antivirals, both held jointly with the provinces and territories as well as in our own federal stockpile, that should be sufficient to treat anybody who needs treatment in the interim until we have the vaccine in place, and for those whom the vaccine is not effective. The plan, again, planning at every level is taking place. In terms of the shelf life, yeah, there's some that are starting to expire now. We're in active conversations with the provinces and territories about how we deal with that. We're also adding to our national stockpile and looking to replenish some of the existing stock with new stock, including adjusting the kinds that we have, adding, for example, amantadine as we recognize resistance, increasing the amount of Relenza, as well as having more pediatric doses in place.
Thank you, Dr. Butler-Jones. Ms. McLeod.
So the question that I would like to focus in on is certainly the Aboriginal population within Canada experience significant health inequities, diabetes rate, cancer. So I'd like to understand what the government is doing to look at improving health outcomes, and as closely related to that, when the government of Canada works in isolation from the work of the provinces, how they're sort of connecting in terms of improving the health of Aboriginal citizens. So not only what we're doing independently, but also how we're starting to coordinate.
Thank you for the question, Madam Chair. I would say, with respect to the coordination, we have two initiatives underway currently, one with British Columbia and one with the province of Saskatchewan to work towards integrating First Nations health services more into the provincial health system. We're a little bit more advanced with BC than we are with Saskatchewan, and we are in discussion with a number of other provinces to try to move in that direction as well, on the assumption that we will have more economies of scale and better service if we pool our resources with the provinces, recognizing that services need to be provided in a culturally appropriate way for First Nations. And in the 2008 budget, $154 million over 5 years was provided to support greater integration with provinces and First Nation health systems. In this past budget, there is $440 million provided for health programs and for infrastructure. And just to break that down, $330 million is provided to stabilize the non-insured health benefits and primary care programs, and $135 million will be used to fund the construction and renovation of health services infrastructure in First Nations communities, including health clinics and nurses' residence. And we expect that this funding will support more than 40 new projects and approximately 230 renovation projects over the next couple of years.
Thank you.
You can have a little bit more. You have a little bit more time if you would like to ask another question, Ms. MacLeod.
Okay. Well, certainly closely related to that, we did hear the minister talk in terms of, health professional shortages, and again, perhaps aligned with the Aboriginal community. Is there some specific things you are looking at in terms of health professional shortages?
Mr. Rosenberg.
Thank you for the question, Madam Chair. Specifically with respect to First Nations, since the beginning of the Aboriginal Health Human Resources Initiative that was put in place, I believe, in 2004, the government's been working with partner organizations and with the National Aboriginal Achievement Foundation to increase the number of Aboriginal students pursuing health careers, including nursing and medicine. Funding under that initiative has more than doubled the number of Aboriginal healthcare students that are receiving support. In the last 4 years of the program, over 1,000 bursaries and scholarships have been awarded to Aboriginal healthcare students, many of whom are studying nursing and medicine. So the other thing that we're doing, while increasing the numbers of doctors and nurses is critical, it's also important to ensure that medical and nursing students are receiving training that will increase cultural competencies of their future practice. So again, through this initiative, a framework for cultural competency has been developed collaboratively by the association that represents all 17 of Canada's medical schools. That is the Association of Faculties of Medicine of Canada and the Indigenous Physicians Association of Canada, and work's now underway to integrate this framework into medical school curricula. And there's similar work underway to address the same issues with respect to the curriculum for nurses.
Thank you so much. You still, very briefly, Ms. MacLeod, have another quick question.
Oh, I guess I'm doing some very, so again, aligned. Primary health care is near and dear, but specifically, mental health issues continues to be a grave concern for Canadians. And so I'd like to, have you perhaps talk briefly in terms of
quickly, Mr.
improving the
Rosenberg,
mental health well-being of Canadians.
If you could quickly, I just gave her some extra within her time limit, so could you quickly just make some comments on that?
I'd mention two things. One, the establishment of the Mental Health Commission a couple of years ago. The government put in, I believe, $130 million over 10 years. And then last year, the Mental Health Commission received funding for a number of demonstration projects dealing with homelessness and mental health.
Mr. Dufour.
Thank you. Along the same line as my colleague, Mrs. MacLeod, in the last report, the Auditor General of Canada noted that it was difficult to establish or measure indicators to assess the state of the Aboriginal and Inuit health. In your opinion, how can the federal government assume its responsibilities properly with respect to the Inuit and the First Nations?
Question.
Generally speaking, with respect to performance indicators, we accepted the recommendations made by the Auditor General. We need to improve our health indicators. We've already begun work. We've already started to make some headway with respect to the First Nations health indicators. This is a matter that comes under the jurisdiction of the federal government. This is a very important priority, and we're working hard to ensure that we have a proper way of getting good results for this group. You said the work is already underway. You have started looking at the report. You have already started implementing the recommendations made by the Auditor General.
Who is the Assistant Deputy Minister for First Nations and Inuit Health Branch, who may be able to elaborate a little bit.
Merci beaucoup pour la question.
Please go ahead. Yes.
Merci, Madame Chairman.
Thank you. I will be speaking in English.
Yes, we're working closely with our partners, the Assembly of First Nations and the Inuit organizations, to ensure that as we develop these new indicators, they're culturally appropriate. And as the Deputy said, we do accept the findings of the report. Also going forward, as the Deputy said, one of our key strategies is to make sure that our healthcare services are aligned and integrated with provincial services. So we're also working in that context to make sure we have indicators that make sense and that are useful in measuring Aboriginal health outcomes. Thank you.
Mr. Dufour, you have some more time.
Thank you. On another issue, last year the Health Committee recommended that we put $80 million into the HIV/AIDS strategy, but out of this money, $11 million was reallocated for an initiative for this anti-HIV vaccination. This proved to be an initiative to make people aware of HIV/AIDS. Will these organizations be receiving this money that was provided for in this initiative? Thank you, Madam Chair. Thank you for your question. With respect to HIV, there are many programs underway right now, and the cost of these programs for community agencies, the amounts have improved, the amounts have gone up. In 2006, 2007, $10.5 million was allocated. In 2007-8, this amount was reduced somewhat, but just last year, $12.1 million was allocated, and we will continue along this same vein. We are increasing amounts for local organizations. On the same topic, now I'd like to refer to the 2009 budget. Do you intend to renew this $84.4 million that was destined for this strategy? Yes. Thank you.
You have a few more seconds, half a minute if you want to add another quick question. You've got it.
I must confess I have no further questions. Thank you.
We will now go to Dr. Carey.
Thank you very much, Madam Chair. And I was wondering if we could elaborate a little bit more on mental health. Last year when I was with Industry Canada, I had the privilege of attending an announcement in Toronto. I think we gave one of the largest grants with CAMH in partnership with some of the other hospitals in Toronto. But I'd like to ask the officials a little bit more detail what the government is doing actually to improve mental health. Are we doing enough for wellness and prevention? Are we doing enough to target our youth? What exactly are we doing at this time to help improve mental health and well-being of Canadians?
Which member of the panel would like to make comment on Dr. Carey's question? Can we have Dr. Rosenberg? Thank you.
Mr.
Rosenberg, sorry. Go ahead.
Yes, I'll thank
Too many
you, Madam.
doctors around here,
Yes.
Mr. Rosenberg.
Thank you, Madam Chair. So as I was, as the committee will know, mental health is a complex, multifaceted problem that is the concern of all governments in Canada, and I would say the concern of lots of other folks in Canada. And I think the Mental Health Commission, just to speak a little bit more about that, has been a unique opportunity, really starting or coming out of the report of the Senate Committee on Social Affairs, and then, of course, the former chair of that, Mike Kirby, became the first head of the Mental Health Commission and has worked with all jurisdictions and with stakeholder groups to bring them on side, so that, you know, mental health, as you know, 1 in 5 Canadians has a mental health issue. That means that just about every family in Canada is touched by mental health, and it touches us with respect to children and youth. It touches us in the workplace. Workplace mental health and depression, for example, is one of the major causes of loss of productivity, not just absenteeism, but what is called by some people presenteeism, that is, people who are coming to work but aren't really working because they're not able to do that. There's also the issue that has to be dealt with of reintegration. A lot, if you look at the long-term disability policies or long-term disability claims in this country, across all industrial sectors, including, I would say, the Government of Canada, a larger and larger percentage of those claims relate not to physical illnesses, but to inability to work for mental health reasons. And one of the real challenges is not only to pay those claims, but then to find a way to get people to reintegrate, because statistics have shown, research has shown, that if people are away for an inordinately long time, the longer they're away, the more difficult it is to ever get them back into the workplace. The Mental Health Commission, as you may know, has set up a series of expert advisory groups. It's got a very elaborated structure with a board of directors, but also all sorts of people who are really interested in every aspect of this. There is, for example, an expert advisory group on workplace mental health. There's an expert advisory group on child and youth mental health. There's a group on Aboriginal mental health. There's a group on mental health in the justice system, where we find sometimes that from two aspects. One, the justice system is sometimes used as a way of housing people that have mental illnesses and may act out violently. And on the other side, there are justice system issues in terms of contract and civil law issues that need to be worked out. So there's an awful lot of work going on through the Mental Health Commission, and as I mentioned, there are the homelessness projects that are being carried out across the country to determine the specific comorbidity around homelessness and mental health, and it manifests itself very differently in different cities. So we hope to get a lot of good research, coming out of that. The Mental Health Commission is also involved in a number of key activities, the most pressing of which I think is the creation of an anti-stigma campaign, because mental health, if I was to ask people in this room if they had a mental illness, they probably wouldn't volunteer it. If I asked you if you'd ever had cancer, probably people would say yes. A few years ago, people wouldn't talk about cancer either. We've come a long way with physical diseases. We have a long way to go with mental illness. The other thing that the Mental Health Commission is doing that's very important is developing a knowledge exchange, a place, whether it's web-based or otherwise, where people can go to actually get information about mental illness, both with respect to caregivers and families and patients, information about the conditions and information about resources to help. And finally, the Commission is developing a national mental health strategy. They've got a 10-year time frame to do their work. They're off to a very good start.
Thank you, Mr. Rosenberg. Ms. Murray.
Thank you. I'd like to just get some more detail about Bill C-51. The minister mentioned that it would be coming back in front of the committee. Clearly in her remarks, she's got a strong commitment to keeping people well and prevention, and that's what the natural products practitioners and industry believe their products do. And I'm sure that, Mr. Rosenberg, you're aware of that despite the reassurances that natural products would still remain available, there was a huge concern across Canada about Bill C-51. So I've got a series of questions that I think actually would be pretty quick to answer. With your indulgence, I'll just read them all out. And the specific perspective that I'm most familiar with is the practitioner's perspective. And I know that you've consulted with the health products, but the industries, but the practitioners, the traditional Chinese medicine, the naturopathic physicians, other complementary health practitioners were very concerned that they would lose access to some of the products that they believe are essential for their effectiveness for their patients. So questions are, one, has Health Canada now consulted with the associations representing the complementary health practitioners? Two, if not, is Health Canada planning a fuller consultation before reintroducing with the amendments in this bill and address that complaint and that very little consultation was done, considering this was an extensive rewrite to a very complex act? Thirdly, will Health Canada be removing natural products from being lumped in with the same category as pharmaceutical drugs? I know that was one of the key requests, but there were many other concerns other than that. Four, is Health Canada investing in research into natural products and complementary medicine modalities? I'd like to point out that unlike the large pharmaceutical companies, primarily natural products and natural medicine is a public good. There isn't a private benefit from that research, so there isn't the incentive for the private sector to do it, and we need more of it, and I know that the natural and complementary practitioners would like that too. And lastly, how is the $12 million of additional voted appropriation being allocated? Thank you.
Mr. Rosenberg?
Thank you, Madam Chair. I will attempt to answer all of those questions with a little bit of help from Mina Ballantyne, who is the Assistant Deputy Minister for the Health Products and Food Branch. First of all, I guess the first question was, did we take into account the practitioner's perspective on this? First, Bill C, and I think that the short answer is yes. I mean, natural health products, there was a regime put in place several years ago by regulation under the Food and Drug Act to regulate natural health products. There's nothing in Bill C-51 that has what is ever intended to change any of that. We recognize that there's a very broad range of products that are natural health products, from the most benign products, and said olive oil might be a natural health product in that context, to other products at the other end where there may be significant interactions with pharmaceuticals, or where the evidence for claims needs to be ascertained if these products are being used, for example, as remedies for serious illnesses. So we recognize there's a broad spectrum of risk that needs to be dealt with, and that what is appropriate at one end of the spectrum might be a very, very light touch, almost nothing, and at the other end of the spectrum, you would want significant evidence, recognizing that that evidence, in the case of natural health products, is different than the evidence that you would have with pharmaceuticals. So that for Chinese or Indian traditional natural health products that have been used for decades, or in some cases hundreds of years, there's lots of traditional sources of evidence that are available, and that we recognize the legitimacy of that evidence. The second question, have we consulted complementary health practitioners? Yes, we have done some consultation of complementary health practitioners. Is there going to be fuller consultation? Yes, absolutely. There will be fuller consultation. I think on all aspects of Food and Drug Act reform. Remember, the reform was driven, isn't really about NHPs. The NHP regime was largely in place. It was our intention to basically just import that. What we were doing was a more fundamental reform of food and drug regulation in this country, recognizing that in light of some of the foodborne illnesses that we had seen, that Canada's regime, Canada's legislative regime, had fallen behind somewhat where our trading partners were, including the United States, were often criticized sometimes for harmonizing to the United States. So this is a case where we're actually harmonizing up to the United States. They have stronger powers, the ability to recall, tougher fines and penalties. Canada's Food and Drugs Act dates back from the 1950s. All modern jurisdictions have moved ahead. It was time for us to move ahead, and that was the crux of the amendments. Amendments. There were a number of them. You asked about the amendments last year when C-51 died with the dissolution of Parliament. It's not currently before Parliament, so in a sense, we're really not talking about C-51, and the government still has to, sort of finalize the package it's going to put forward. But at that point, in response to the concerns of natural health product practitioners, there were a number of amendments that were proposed by the government that would have made, I think would have assuaged the concerns of those practitioners and would have made it quite clear that we are not treating natural health products in the same way that we're treating pharmaceuticals, and we made quite a clear definitional distinction between natural health products and pharmaceuticals. As far as research, I guess the answer I would give is the research that we would do would be research within a regulatory context. So as I mentioned, we are going to be taking a risk-based approach, and we will be looking for evidence of safety and efficacy of products. And again, the evidence is different. It will use traditional sources of evidence, but to the extent that we have this regime, and this is really no different than what was there before, we would be doing that kind of regulatory research to satisfy ourselves that the products were safe and efficacious. And then finally, on the $12 million, I'll turn it over to Mina Ballantyne.
Thank you. Thank you, Madam Chair. In terms of the $12.5 million, when these regulations came into force in 2004, there was no stable source of funding with these regulations. So what's happened now is with these supplementary estimates, we now have a program of natural health products. So part of the money, the bulk of the money, about $8 million of it is going to go to the Natural Health Product Directorate so that we can clear the backlog by 2010, which is what the Minister talked about. We've got a variety of business process improvements in place. So the Natural Health Product online system where industry can come in with pre-cleared information, which is like having a recipe, which we say that if we know something about this product and it conforms to this recipe, then companies can make these submissions online and can receive their application and their license within a few days. So it's for those low-risk products where there's a lot of information we can do that, and for other kinds of products we'll have to work on them. So we're doing a lot of business process improvements, and that's what the Natural Health Product Directorate will use that money for. But now we also have in place with the Marketed Health Products Directorate a system to be able to monitor adverse events that happen or adverse reactions with natural health products. Because as we all know, natural doesn't mean it's no risk, it's really low risk. And with the increasing problems of contamination and counterfeit, this is an area that we need to really pay attention to in terms of monitoring the adverse reactions and events that happen with the use of natural health products. And as the Deputy said, sometimes they're used in combination with pharmaceutical products as well, so there are a lot of reactions that we need to be on the alert for. And then part of the money is going to be to put into place a compliance and enforcement regime as well. So the inspectorate in the Health Products and Food branch will also get part of this money to make sure that we work with industry and to help them in terms of compliance promotion with these regs and and also to take enforcement action as necessary and as reasonable whenever we need to. Okay. And if I may, Madam Chair, on the point of consultations, Canada's hosting an international conference on the harmonization of complementary health products with WHO, China, India, Australia, the Europeans, the States, and that's on February 24th and 25th in Montreal.
Thank you so much for your very insightful remarks. Mr. Uppal.
Thank you. I'm going to go back to health, human resources, and I know Minister addressed issues in the north, and but I'd like to touch on rural communities. It's important for those people that live in rural communities that should have access to health care that they need and the health care providers. So what is the department doing specifically for those living in rural communities?
I'd like to answer that question. Mr. Rosenberg?
I'll take that. First of all, just generally, we do recognize that in parts of the country and often more exacerbated in rural communities, there are shortages of doctors and nurses, and that there's a need to take concrete steps to address that problem. So just to provide kind of a general backdrop, the government will transfer, as the minister mentioned, $22.6 billion this year as part of the health transfer, and that grows by 6% a year. There's also an investment of $38 million a year through the Health Human Resources Strategy and Internationally Educated Health Professional Initiative, $20 million for the Health Human Resources Strategy, $18 million for the Internationally Educated Health Professionals Initiative to support efforts to ensure an adequate supply of doctors and nurses. We're working with PT governments to develop a common national assessment also for internationally educated doctors and a common national assessment that would streamline the process of getting foreign doctors licensed to practice medicine in Canada, which would make, we think, a big difference in rural and remote communities that are eager to attract those doctors. An interesting thing that we did with the Government of Alberta and the nursing regulator in Alberta is that we've developed an assessment process that can be used overseas to evaluate the credentials of nurses who want to come to Canada, and that'll reduce the long delays that many nurses face waiting to be licensed to practice their profession. I think all of those things apply generally. In some cases with planning, and I think it is important that there be a concerted table that would involve all the players, that is the provinces, the regional health authorities in the provinces, Canada through Health Canada, and also through Immigration Canada, because there has to be coordination given the ability to prioritize and focus on identifying specific provincial needs and bringing health professionals in to meet those needs and hopefully to be able to get people, to incent people to settle where the needs are greatest. The other things that are happening is that we have had discussions, and I can't give you the outcome today, with the medical schools about who gets places, and I think it's fair to say that people who come from rural areas may be somewhat more likely to go back home. And so the issue of the distribution of seats in medical schools, I think, is an important issue that has to be looked at, and so that rural parts of provinces should have fair access to some of those seats as well.
Thank you very much. You have another quick question.
Quick question. You talked about the coordination between departments, very important, but can you tell me a little bit about coordination between or further cooperation between the federal level and provincial level of government in terms of health care?
Thank you, Madam Chair. I'm happy to answer that question. There is coordination that goes on multiple levels, and I'll name a few things, that it will not be an exhaustive list. A good example of coordination, CIHR will be here on Thursday. A key federal role is the research role. CIHR research contributes hugely to both medical research to finding cures or better treatments for diseases, research with respect to better management of the health system. CIHR was instrumental in doing research, for example, on wait times benchmarks. That would be one example of cooperation. Another example of cooperation would be the work that we do with provinces with respect to drug approvals. The committee some months ago did a review of the drug approval process under CADIF, and that's something we work on closely with the provinces. We also, through our health products and food branch, have an important role in approving drugs for their safety, for their safety and efficacy. And we obviously, that's an important factor in terms of getting drugs onto the market. There are other programs like the Special Access Program that Health Canada runs that enable physicians to get access to off-market drugs. There are also programs, obviously, that we're working with, and David can speak a little bit more about initiatives under public health, the Public Health Network, for example, coordinated work that we do with respect to health promotion and disease prevention, national strategies on disease prevention, and of course, I spoke at some length about the mental health strategy. So there is lots of work going on at all levels.
I'm sorry to interrupt you, Mr. Rosenberg, but I think Dr. Butler-Jones wants to make a comment, and we're just almost at 5:15, and we do need to go in camera at that time. So,
on a point of order, Madam Speaker. Point of order.
Cut you off. Yes, Ms. Washington.
Could I ask, since I think we went over a few of the exchanges, to have the committee extended by 5 minutes so I could get one chance at raising a few questions?
Well, we'd have to take that to the committee. Is it the will of the committee to, I think some other people have some obligation. In fact, I know they do have obligations right at 5:30. I'm one of them. So, Dr. Bennett?
I think we should extend in that I don't think that any of us knew about the 5:15 meeting. So I think
yes, you did. I announced it right at the beginning.
At the beginning of the meeting. We didn't choose to do that. That wasn't the decision of the committee. That was the decision of the chair. So I would prefer that Judy get a question.
To do that. Any other comments on that? Yeah. Then we will not get to our business today, but if that's the way the committee chooses to do it, would you rather just continue with the questions? And we'll do our business another day? All right. Let's do that then. or Dr. Butler-Jones.
Thanks. I think Morris largely covered it, other than because public health issues cross jurisdictions, collaboration really is essential. Et je veux clarifier ma réponse de la question de Monsieur.
Going back to Mr. DeForest's question.
My proficiency in English, let alone in French. What I need to be very clear is that the federal government's commitment to funding of HIV/AIDS continues into the next year at greater than $84 million, and the amount that's for local community groups increased this current fiscal year by $2 million, and that will continue into the next year. So that's the total contribution.
Thank you. Mr. Opal? No. I'm sorry? Ms. Washalese, go ahead.
Thank you, Madam Chairperson. Well, just on that, I still haven't got a clear question about whether or not there's going to be any further reductions of monies to the AIDS Community Action Program, who already experienced a $26 million cut last year.
I'm not aware of any $26 million cut. The total federal commitment is, as I've said, to the community groups.
No, but I'm asking about the
there's no plans for any additional.
Okay, so good. Now, if I could ask specifically then about the $72 million in cutbacks listed in this year's budget over the next 3 years, cutbacks that affect both the Public Health Agency and Health Canada. Could I get a breakdown of those cuts?
We don't have that here today. We'd be happy to provide it later.
Could I ask if it could be provided as soon as this committee is done or by tomorrow?
I cannot make that undertake. I'll have to speak to my minister about that, and we will provide it as soon as we can.
All right.
Mr. Rosenberg. Ms. Washalese, do you
thank you.
Just excuse me. Dr. Butler, did you have a comment?
I was just saying the minister had made a commitment and her willingness to come back to committee on those items.
Absolutely. So. Ms. Washalese?
Could, Mr. Butler-Jones, could you tell us whether or not the Community Action Program for Children will continue after this fiscal year?
Try not to touch. We've already committed through 2010. At 2010 is a time when all the authorities expire, and we have to renegotiate the authorities. But there is no plan to do anything other than to continue at this moment.
And the same for, can I just have some assurances that nowhere on the list of cutbacks appear the Centres for Excellence for Women's Health?
Who would like to answer that question? Mr. Rosenberg, would you like to make comment?
I believe that women's programs will continue as they are.
Thank you. Ms. Walsh-Lee.
Thank you. Looking forward to that complete list so we can complete the estimates process. I don't think any of us wants to sign off on anything until we get the complete story. I would like to know on Aboriginal health. Mr. Rosenberg, you talked about $135 million in terms of infrastructure investment for nurses, residents, and health clinics. You know, and I know, we all know there's a huge nurse shortage on reserves. How are we actually going to train the nurses and get them in place at the same time that we're going to have these residents up and running, which I assume is in short order given the statements by the government?
Thank you, Madam Chair. I'd be pleased to respond to that question. In terms of the investments in infrastructure, it's for health facilities and nursing residences, including a lot of repairs to existing residences. You're right, it is a challenge to hire nurses, so we have invested a lot in recruitment and training of nurses, and we have initiatives that we're doing now, working provincially, and we have different strategies in different provinces depending on what the needs are. We're also working on retention strategies, improving our housing and our training for nurses. So, you know, we are seized with these issues, but a lot of the money as well isn't just for hiring nurses, but it's also to ensure that there's other supports in place. For example, we're looking at potentially changing the mix of nurses and hiring other professionals like potentially health paramedics to assist nurses in doing their work. So it's
Is there a budget line for hiring retention of nurses and other professionals on Aboriginal First Nations?
Budget line, we're investing.
Yeah, is there an amount of money set aside for this?
Yes, there is. Out of the $305 million, there's $30 million a year for improving nursing. And in addition to that, in budget 2008, there was another $34 million invested over 5 years to do training of nurses and recruitment and retention of nurses. So altogether, we have a total investment of $95 million.
Over 5 years?
Well, the first $30 million, the $60 million is over 2 years, and then the $35 million is over 5 years.
Okay. Sounds like a pretty small amount for such a big problem, but I won't ask you to comment on that. I would like, before you go, to ask about the how much money has been recouped from the millions of dollars that were robbed out of the system by the former ADM of Health vis-a-vis the Virginia Fontaine Sagin Solvent Abuse Center.
Go ahead.
I don't have the total, but what I can say is that obviously Health Canada takes that situation very seriously. And for everyone who is implicated in that incident, we're doing everything possible to recover funds for the taxpayer.
Can you get back to us with an amount of money recouped?
Yes,
okay.
I can.
Last question, I think, because my time's running out.
I'm sorry, your time has run out, Ms.
Real
Walsh-Lee.
quick question to Dr. Butler-Jones. Just in
Mr.
terms
Brown.
Okay.
Mr. Brown,
thank you, Madam Chair. Two questions that I'd like to ask the department officials today. First one, just to build upon what Mr. Uppo was raising in terms of foreign accreditation. I've met a number of foreign doctors in my riding who have explained to me the difficulties in the process, and I'm pleased to hear that there's enthusiasm and interest in addressing the problem. One aspect of the problem that I've been alerted to was the cost of the equivalency exams. I think of a couple, Kesey and Sokol and Barry, doctors from Eastern Europe who had 4 kids, and that they were working minimum wage to pay for the cost of their equivalency exams. And they said with the books and the exam cost, it was $2,000 for each of them. Is there any discussions with the respective provincial bodies of how we can reduce the stigma associated with these immediate costs at a time when these new doctors don't have a supply of funds available. My second question is in regards to electronic health records. If I think back in recent budgets, 2006, there was an incredible commitment to electronic health records, and again more recently, there's been an even stronger commitment. I was talking to the CEO of my local hospital, Royal Victoria, and they mentioned that in other provinces they understand some of this funds has trickled down. But in Ontario, it appears that it hasn't actually trickled down to a hospital level. Is there any measurements being done to how the electronic health records are being dispersed, and are any provinces needing more of a nudge to get moving on it?
Who would like to take that on, Mr. Rosenberg?
Thank you, Madam Chair. If I could start with the electronic health records first. As you're aware, there was an additional investment in Canada Health Infoway in this year's budget. Canada Health Infoway is, I would say, a very prudently managed enterprise, and will release money as they have assurances that projects meet a strict set of criteria. And not everybody started at the same time. I think that Ontario may have gotten off to a bit of a slow start on this. So we have some variability in the country. It's not an even sort of raising. Not all boats are going up at the same time. We recognize that, and so Infoway, which is an arm's length organization, will consider the pace at which the health record has been implemented across the country, and you may see some differentiation, as there has been up until now, in the next round of disbursement. But that'll really be up to Infoway working with the jurisdictions based on the soundness of the projects that are put forward. With respect to medical professionals and barriers to entry for foreign-trained professionals, this is a concern that I think that we're looking at in two ways. We have, through the Internationally Educated Health Professionals Initiative, supported work with the provinces and territories and stakeholders to facilitate the integration of medical graduates. And there have been a number of initiatives that include a central pathfinding website for international medical graduates so that they can have one stop to understand what the opportunities are. The ongoing development of a harmonized national assessment international medical graduate process, and faculty development program being developed to better prepare physician teachers to work with international medical graduates. I think the point you raise is not one that we specifically dealt with. I think it's an important point, and it's one that I will undertake to raise with the Committee of Federal, Provincial, and Territorial Officials that's looking at this. There's also work going on under the auspices of Human Resources and Development Canada to try and harmonize across the country requirements. It's work that very much dovetails the work that we've been doing on international medical graduates, and that's another forum to raise the issues of reducing as much as possible barriers to mobility, both within Canada and for people coming into Canada.
Thank you very much, Mr. Rosenberg, and that brings us to the end of our time for this line of questioning. And I want to thank the panel for coming in today and giving us your most insightful information. Thank you for that.
Since we had such a short time with the officials, could we have them back on Thursday, please?
Well, we have an agenda for Thursday. What's going to happen on Thursday? Thank you. I'll just go over that. For Thursday, we have witnesses that are coming in from the Assisted Human Reproduction Canada. We have the Canadian Institutes of Health Research. We have the Patent Medicine Prices Review Board witnesses, and we have the Hazardous Materials Information Review Commission. On top of that, at the end of the day, I do need to call the committee for 15 minutes for their advice on some very important business that's coming up.
Could I just make the suggestion that for next Thursday's meeting, that we divide the time between these officials for 1 hour and the others for the next hour, and we find another time for the committee to discuss other business? Perhaps we could call the steering committee. I think given the fact that this is estimates, we're dealing with a huge budget, big changes, I think I certainly don't feel comfortable moving on approval for estimates until we have appropriate amount of time to deal with them.
Well, as you know, Ms. Washlees, that is at the will of the committee, so we will have that open for discussion at this time, and of course, whatever the will of the committee is. Can we have this open for discussion?
And what it is, I'll move the motion that we, or whatever. Since
just one moment. Dr. Carey?
If
like
the
to
committee would
understand what
like
I'm
to further investigate, I think that actually is a good idea that we do that.
Thank you so much. I would like to hear from, yes, Dr. Bennett.
I just think that if, because again, it's difficult for members to get the questions, and in terms of the rounds, I don't know about the availability of Dr. Butler-Jones and Mr. Rosenberg, but it would be fine with me if they were all at the table at the same time, and the members could pick and choose whether their question was for CIHR or for the department or the public health agency.
Well, that wouldn't work. There's a lot of witnesses coming in. I don't think they all could be there at the very same time. We have 7 people would be sitting over and above these 3. You have 10.
But unlike other panels,
Yeah.
this is estimates. So your question tends to be for one person, not you're not asking all 7 people to answer all your questions. It's a question to the CIHR, it's a question to the public health.
Madam Chair, I'd like to point out that most of the questions that I asked today, well, the witnesses answered by saying, wait until Thursday, and you yourself said this, wait for Thursday. So if I can't, during the meeting, ask my questions, people who could answer my questions, I'll have a problem with that. So, indeed, we should be hearing from the agencies on Thursday. I'd like to be able to hear them during the time allocated for question period.
Is there any other discussion around the table about this particular, I'm sorry, Dr. Butler-Jones?
I'm sorry, Morris Rosenberg and myself have a conflict on Thursday because it is Deputy Minister's retreat, so that would be a challenge for us in terms of our presence here.
That is very useful information if you can't make it on Thursday. Any other comments? Yes. Well, I think what we need to do then is have a discussion on this, and perhaps we can bring you back at a time when it's convenient for you. I know Thursday is a pretty full agenda, and yet there's some very good comments that have been made around the table today. So we will continue on as we were going to continue on Thursday, and we'll have that discussion at the next meeting. So meeting adjourned, and thank you again.